Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq, and today our topic of discussion in infectious medicine is the encephalitis diagnosis. This topic we will discuss in 5 different sections, and in the first section we will discuss the CSF examination of the patient with encephalitis and what's the CSF profile in encephalitis and pleocytosis, and also we will talk about the CSF cell count and infections, red blood cell count, and glucose concentration. So all that we will talk about in the first section of our topic, which is CSF examination. Then in the second section, we will talk about cerebrospinal fluid, CSF PCR, which is polymerase chain reaction of cerebrospinal fluid, varicella-zoster virus infection, Herpes simplex virus, CSF polymerase chain reaction, enterovirus, and Epstein-Barr virus polymerase chain reaction. So these PCR of cerebrospinal fluid, specifically we will discuss in relation to these different viruses like varicella-zoster, herpes simplex, enterovirus, and Epstein-Barr virus. Then in the third section, we will talk about the culture of cerebrospinal fluid, and then serological studies and antigen detection of herpes simplex virus and varicella-zoster virus encephalitis. Fourth section will be about the imaging techniques like MRI, magnetic resonance imaging, CT scan, EEG or electroencephalogram, and also the brain biopsy. And in the fifth section, we will talk about the differential diagnosis of encephalitis, which will be autoimmune causes of encephalitis. Then we have raccoon, pinworm, flavivirus, and West Nile virus encephalitis, and rabies encephalitis. So basically, the purpose of this lecture is how we diagnose and what are the different tests that we can perform to diagnose the encephalitis. And the most common cause of encephalitis is the viral encephalitis. So we will discuss the different diagnostic procedures that can lead us to the diagnosis of viral encephalitis, and also we will talk about some differential diagnosis of the encephalitis. So keep watching this lecture to learn about the diagnostic steps or diagnostic procedures of the encephalitis.